Berberine, a natural shield against glucose, cholesterol, and blood pressure. Hey there, fellow enthusiasts. Today I am thrilled to dive into a topic that is often overlooked but holds immense benefit for our heart health: blood sugar and cholesterol levels. I get a lot of questions also. Can I use berberine with my medications? Does it interact with this? Doesn't interact with that? Look, it is a supplement. It is an herb. Nobody will have great answers for those. I don't think it's going to have a lot of interactions or problems with your medications, but they're supplements, right? So that's why we call them supplements. They're complementary. So if you think it is causing problems, then you should talk to your doctor or maybe adjust the other medications. But again, it's going to be hard to answer all of your questions about, does it affect this medication, that medication? It's going to lower your blood sugar? Yes. It's going to lower your cholesterol? Yes. Do you still need the other medication? I don't know. So you got to talk to your doctor, right? So sometimes we get a lot of unreasonable or unrealistic questions that we may not be able to answer. So, and especially with the legalities in the US, we are not going to treat you over the chat message. So just please be respectful of that. But let's go into the realities of berberine. I'm talking about an herb that may be just an all-in-one solution that you have been looking for. Did you know that this herb can only lower your risk of heart disease and also help manage your blood sugar and cholesterol in check? It's pretty good, right? As they say, the devil is in the details. So let's not waste any more time and uncover the secrets of this amazing herb. Are you ready? Let's get started. I'm going to get a little technical, so raise the volume, because some people say, I don't hear you. Well, raise the volume and listen carefully. I speak slow for a reason. Endothelial dysfunction, the lining of your arteries, is a factor in most heart problems, such as the formation and growth of a plaque, high blood pressure, coronary artery disease, chronic heart failure, peripheral artery disease. Now, endothelial stability is mostly changed by pro-inflammatory cytokines and decreased adiponectin production. I'm not going to go into too much detail about what cytokines are and adiponectins are, but if you're educated enough a little bit, you will be able to understand. If not, take a note of those and do some research later. So, these two things are important in obesity, insulin resistance, and high blood pressure. The end effect is an imbalance between the production of the inflammatory and pro-inflammatory molecules that eventually close up your blood vessels, and they cause the cells to stick together, and that causes the plaque formation. Now, berberine works at different amounts to bring endothelial homeostasis back to normal. Now, adenosine monophosphate activated protein kinase, we call this AMPK, is probably at the heart of why berberine seems to have such a wide range of effects. Now, endothelial AMP kinase plays a big role in recovering the balance of vascular health by activating nitric oxide, adjusting cellular energy, stopping cell death or apoptosis, some of you know that, and controlling inflammation, extra blood vessel formation, and controlling the blood flow. Berberine stops the buildup of reactive oxygen species inside the cells, the cellular apoptosis, the inflammation, which are all signs of vascular damage and are mostly caused by high blood sugar. Berberine can stop cells from multiplying and protect the blood vessels. Now, berberine cuts down on the number of monocytes that stick to vascular cells, which is a sign of atherosclerosis starting early on. Berberine also stops the production of pro-inflammatory cytokines, which are caused by high blood sugar. And if they're unchecked, they will create the arterial plaques. Now, how about the pressure in the blood? Now, berberine has been shown to lower blood pressure by stopping the release of the enzyme called adenyl cyclase. This make the blood vessels widen, this molecule, and berberine increases the action of acetylcholine. Now, vasodilation and a drop in the blood pressure can happen with the relaxation of the smooth muscles in the blood vessels and relaxation of the endothelium. Now, berberine makes the endothelium produce more nitric oxide and causes the endothelium to relax. For example, in a rat model, high blood pressure 5 to 10 milligram per kg of berberine given to these rats and improved the ability of heart to beat better, and it stopped the myocardial fibrosis and slowed down the loss of heart muscle. It was also found that berberine works like a calcium channel blocker to lower the high blood pressure and prevent the thickening of the blood vessels. Now, regulation of this glucose AMP kinase is a key part of how cells and the whole body keep the energy levels stable. Now, berberine changes how glucose is used in the body, in part because it turns on the AMP kinase. In a rat model of diabetes, berberine was found to change the expression of genes that help break down high energy intermediates and help glucose get into cells in a way that insulin doesn't. Insulin makes cells take in more glucose by activating phosphatidylinositol 3 kinase, encouraging the development of glucose transporter 4, which in short is GLUT4, on the cell surface. On the other hand, berberine seems to make glucose move by increasing the expression of GLUT1. And these effects are caused by the activation of AMP kinase, which regulates both short-term and long-term changes in the metabolism. This makes the body make more energy and store less fat. More specifically, when AMP kinase is turned on, particular organs take in more glucose from the blood and they use it instead of turning it to fat. In a mouse model of type 2 diabetes, berberine reduced both the blood sugar and insulin levels before breakfast. Because if your blood sugars are less, you don't need as much insulin, right? It made the body more sensitive to insulin. That's the reason. The results were the same as those of a double-blind placebo-controlled study, which showed that giving berberine to people with type 2 diabetes lowered their fasting and post-meal plasma glucose levels and had a small effect on their post-meal insulin and body weight. Berberine was also shown to lower fasting blood glucose, hemoglobin A1C, general insulin levels in people with type 2 diabetes at the amounts similar to metformin and pioglitazone, proving that the insulin receptor was turned up, and berberine is better than TZDs such as pioglitazone because it stops the pre-adipocytes from changing into adipocytes. What does it mean? Well, it doesn't make you gain weight. Pioglitazone makes you gain weight, right? So that's why it's better than pioglitazone in that regard. And they lower the triglyceride levels with the help of berberine. Now, instead of TZDs, which is pioglitazone, which make people gain weight, berberine may be a better choice for people with diabetes who are overweight or insulin resistant. Well, good luck explaining that to your endocrinologist, but you can do your own research and understand what I'm saying. Blood fats in both human and animal studies. It's been shown that the berberine lowers the amount of cholesterol and triglycerides in the blood. Downregulation of low-density lipoprotein, or LDL-C, by increasing the LDL receptor expression in the liver seems to work. Well, there's a medication that does that. That costs $1,000. But berberine, $20, $30. So Now, having said that, I'm not saying that don't use the medication doctor prescribed to you. I'm just making a comparison here. Now, this works different from the statins, right? Because statins are totally different, but your cholesterol will go down. In addition to increasing the production of the LDL receptor that picks up the cholesterol by the liver, berberine lowers the cholesterol by stopping the body from absorbing cholesterol and making it leave the body more quickly, which is great. Now, when atherogenic rats, like the rats with atherosclerosis, were giving 50 to 150 milligram per kg of berberine, the total cholesterol and non-high density lipoprotein, which are the bad cholesterol, went down by 29% or up to 33%. It also stopped 40 to 51% of the fractional cholesterol in food from being absorbed. Now, these results show that there is a link between plasma total cholesterol or non-HDL levels and cholesterol absorption rates. This is because the uptake and release of cholesterol by enterocytes, which are your intestinal cells, slows down. The fact that the berberine lowers lipids, the cholesterol, may also be because it makes the liver release cholesterol into the bile, which goes to your intestines and then you poop it out. This was shown in a study where rats with high cholesterol were given either 50 milligram per kg or 100 milligram per kg of berberine. At both doses, the amount of cholesterol in the liver went down slowly and the amount of cholesterol in the bile went up. In another trial, hyperlipidemic hamsters were used to show that the berberine and plant stanols together blocked cholesterol absorption better than either one alone. Now, when berberine is mixed with red yeast rice, it seems to also work better at lowering cholesterol. In a double-blind, placebo-controlled study, people with hypercholesterolemia who took the same combination saw a big drop in their total LDL cholesterol and triglycerides, and this shows that it works. It's important to note that the berberine alone doesn't seem to have as much of an effect as a statin treatment. I know you hate statins, but it may not be as strong because statins have been shown to lower cholesterol up to 50%. But guess what? It's natural and it works. Now, what about heart failure? Due to the congestion in the body, right, in the heart. In a double-blind, placebo-controlled study, people with congestive heart failure who took berberine at a dose of 1.2 to 2 grams a day had significant improvement in their 6-minute walking distance, left ventricular ejection fraction. People will know these terms if they already have heart problems. But also ventricular premature complexes, which is a rhythm problem, and non-sustained ventricular tachycardia after 8 weeks of treatment and 24 months of follow-up. No bad effects were said to happen. Also, up to 9% of people in the berberine group died versus 16% of people in the control group who did not take berberine died. Patients with heart failure who did not respond to digitalis or diuretics were helped by a quick dose of berberine. More specifically, it also lowered the pressure at the end of the diastolic phase of the left ventricle, which affects your heart function. Now, in a rat model with cardiac hypertrophy, animals given berberine at a dose of 10 milligram per kg per body weight for 8 weeks, starting at 4 weeks after aortic banding, they had significant reductions in whole heart and left ventricle size, as well as lower left ventricular and diastolic pressure. I know that sounds too complicated to you, but believe me, if you listen carefully and if you watch a few other videos, you will understand exactly what I'm talking about. In a dog model of cardiac ischemia, which is low blood flow and lack of oxygen, berberine 1 milligram per kg within 3 minutes of left ventricular failure, followed by a constant dose of 0.2 milligram per kg per 30 minutes over 10 days, improved cardiac output. Now, you don't have to do all this things like in real life. These studies are done to prove a point. So, berberine lowers the end diastolic pressure of the left ventricle, the diastolic blood pressure, systemic vascular resistance, which is important for your blood pressure, and more importantly, it does not change the heart rate. Now, this all shows that the berberine may be able to improve the function of the left ventricle, which is the main ventricle in your heart, by having positive inotropic effects, which meaning that it helps pump the blood, making the blood vessels in the body a little bit wider as well, which helps your heart to get the job done easier. Let's talk about some interactions, some safety issues. In the therapeutic amounts, berberine is usually well tolerated, and there are only a few reports of side effects. High amount of berberine can cause low blood pressure in the arteries. So if your blood pressure is already too low, be careful. Sometimes shortness of breath, sometimes flu-like symptoms, sometimes stomach pain or diarrhea, ulcers in the stomach if you're already prone to it. So be careful with those. Now, there may be some increase in the bilirubin in pregnant women or babies, which we don't recommend berberine to begin with anyways. So you should stay away from this berberine or any of these herbs when you're pregnant or when you're breastfeeding, etc. May not be the best time to experiment with these herbs. Because when berberine was given through IV, that has caused some bilirubin increases. Allergic responses can happen to anything, anytime. So keep that in mind. Now let's summarize this. The AMP kinase cascade seems to be how berberine affects the heart. This is the main route that is linked to cardiovascular and metabolic disorders. That includes the insulin resistance, right? So berberine works well to treat high blood pressure and protect your heart by improving endothelial homeostasis and lowering the blood pressure. Many studies show that berberine can help people with type 2 diabetes lower their blood sugar, their hemoglobin A1C, and their insulin levels by improving the sensitivity. It can also help your body to lose weight if you are trying to lose weight. So berberine is a really helpful addition to your tools to treat, to help, to manage your type 2 diabetes or metabolic syndrome. Always check with your doctor. The fact that the berberine is safe and it works well with a variety of other combination of treatments with your cholesterol, etc. And if you cannot take statins, that's also great news, right? That can still help you to achieve your goals. Still discuss with your doctor to see what they say. Clinical studies on people with type 2 diabetes, metabolic syndrome, heart failure show that it is safe and effective for doses between 0.5 to 1.5 gram a day, usually in 2 or 3 doses. In the real world, this dose range may change depending on what supplement you use, etc. But if you are going to SugarMDs.com and getting the highest quality supplements we offer, the dosing is exactly what you need. So you don't have to worry about that. Thank you for watching. I will see you in the next video. Remember, thumbs up, share, like, subscribe. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.